they have a 25% risk of dying from that if they get chronically infected in the newborn period. Hepatitis B is caused by a virus, the hepatitis B virus, and when people get it, it can cause inflammation of the liver. That can result in stomach aches, nausea, vomiting, diarrhea, and it can cause a prolonged illness for weeks to months and result in weight loss. And then some people will be familiar with some of the more typical signs like jaundice, so yellowing of the skin and of the whites of the eyes. Hepatitis B can be fatal. Most people do recover, but it can cause liver failure, fulminant hepatitis, and this could result in death or maybe the need for a liver transplant. Hepatitis B is in blood and body fluids, so it can be spread when you get exposed to those. So many people, I'm sure, have heard on the news and other places that you can get hepatitis B by intravenous drug use, for example, or high-risk sexual activity, and certainly through the birth process. Children can get exposed to hepatitis B. But what a lot of people don't realize is that it can be transmitted in many other less casual ways. So we know, for example, that just household contact, living in a house with somebody who has hepatitis B, that's a risk factor for infection. And so that we don't traditionally think of as like big exposure to blood and body fluids, but it's clearly transmitted in ways that we don't fully understand. We know that the virus is quite hardy. It can survive on surfaces for up to 7 days. Sometimes with chronic infection, it can sort of percolate along without any symptoms until it does cause problems years down the line. So in the meantime, people might be feeling quite well, and so they don't even know that they have infection. So there are advances with antiviral treatment for hepatitis B to get rid of the chronic infection. Unfortunately, a lot of people aren't aware of those, and so they're not utilized as much as we would like. And many people who have chronic infection don't even know that they have the infection, and so then they don't get access to those treatments. One of the reasons for children to be vaccinated is to prevent chronic infection. So after recovery, they may be chronically infected, and then that chronic infection can lead to problems years later, like chronic hepatitis, cirrhosis, and even liver cancer. And actually, there's more morbidity and mortality from chronic infection compared to acute infection. And children are more prone to being chronically infected when they get infected compared to adults. So the youngest children, kids who are infected in the newborn period, if they're infected, they have a 90% risk of going on to have chronic infection. Whereas for older children and adults, when they get infected, it's much lower. It's 5 to 7% risk of chronic infection. When children do get chronic infection with hepatitis B, the importance of that is that the consequences, the bad outcomes, the cirrhosis, chronic hepatitis, and liver cancer, they have a 25% risk of dying from that if they get chronically infected in the newborn period. Normally, the usual schedule for the hepatitis B vaccine is to give 3 or 4 doses in the first 6 months of life. That first dose is at birth. The hepatitis B vaccine is really effective. You get a good immune response after the series, about 95% of the time, and immunity is believed to be lifelong. So it does protect very well against hepatitis B. And then even if you do get breakthrough infections, they're normally asymptomatic, and then they don't result in that chronic infection. So they do prevent those long-term consequences of infection. The hepatitis B vaccine has been around for decades and has really been well studied. And the universal infant immunization program, that was recommended all the way back in 1991. So we've got decades of experience with hepatitis B vaccine safety. There's no new safety concerns that have popped up over the past few years. The vaccine is very well tolerated. For those adults who've had it, it can cause pain at the injection site, soreness, and that goes away in a day or two, but that's the most common side effect. Again, I think the most important thing to think about is that the highest risk of a child getting chronic infection and the consequences of that chronic infection is the younger they are. And that's why we want to make sure that children are protected right from the get-go. And that's why that birth dose is so important. And if parents really do have more questions about hepatitis B vaccine or other vaccines, I'd recommend talking with your doctor, your healthcare provider, about that.